Hi everyone, we have a high-yield concept that appear repeatedly in the question of the NBME and UWorld, which is asked about the sodium-potassium pump and also about the mechanism of action of digoxin. Also, there is an NBME question about the arrows in patients who are taking digoxin. So we should know the normal physiology first, and then we discuss the digoxin effect. So firstly, we have extracellular and the intracellular space. We should know the cation that is in the intracellular, which is predominantly the calcium and the sodium, whereas the extracellular we have potassium. So we have here a sodium potassium pump, which is sodium potassium ATPase pump. When sodium potassium ATPase pump activated, it will lead to shift of the intracellular cation sodium and exchange with the potassium. So sodium exit the cell to the extracellular, and the potassium will enter the cell to the intracellular space. Usually this is called the 3 sodium 2 potassium exchange, mean that it exists exit 3 sodium in exchange with 2 potassium. This is the normal physiology. Also, when there is a build-up of sodium in the extracellular space, it will lead to activation of the sodium calcium pump. So when there is a high sodium in the extracellular, it will lead to exchange of the sodium with the potassium. So the sodium will go in and the calcium will go out. So calcium will go out and the sodium will go in. So this is the normal physiology of the sodium potassium pump. So the mechanism of action of digoxin is that it will inhibit the sodium potassium pump. I mean, it will inhibit the sodium potassium pump. This is digoxin. So it will lead to build up of the sodium intracellularly. So there is no exchange of the sodium within the potassium. Also, when there is a build-up of the sodium intracellularly, it will lead to also inactivation of the sodium potassium pump, because we already said that the sodium calcium pump depend on the sodium outside of the cell to be activated. So this also lead to increase intracellular calcium, and and the potassium already in the extracellular. So the net effect or the arrows in patient on digoxin is that increase sodium and calcium intracellular and decrease intracellular potassium. So this is a very important arrows to know that the sodium and calcium build up intracellular, and the potassium will decrease to the intracellular, and this will lead to the effect of the calcium of the digoxin, which lead to increase myocardial contraction, because we have now increased calcium inside the myocytes and the myocardium, and this will lead to increased contraction. So also you should know that the digoxin is one of the inotropic drug. And thanks you for listening.